Hey sassy Nari, welcome to Little Fixes. This is your host Mehekta, a social media professional, a mother, and a simple yet sassy woman just like you. Join me for sweet, simple, and practical ideas that help you in transforming into your best self. This mental health and personal growth podcast is a reminder that you matter. Hello sassy Nari, thank you for joining me today. This episode will blow your mind, improve your hair health, and help you in saving a lot of money as well. So ever since I have moved to Bangalore, my hair fall has increased. It was a lot earlier, but अब 10 महीने में कुछ सेटल हो गया है. पर एक बात तो क्लियर है कि ये हेयर फॉल ना, it messes up with our head, not just literally, but also because it disturbs us mentally as well. स्ट्रेस से हेयर फॉल से स्ट्रेस. सो एनीवे, आज अपने हेयर से रिलेटेड मिथ्स एंड फैक्ट्स की बात करेंगे. आपको एनलाइटन करने के लिए मेरे साथ हैं सीनियर कंसल्टेंट डर्मेटोलॉजिस्ट डॉक्टर गुलहिमा अरोरा. शी इज द फाउंडर एंड डायरेक्टर ऑफ मेहकता डर्माक्लिनिक इन न्यू दिल्ली. Dr. Gulhima holds special interest in hair restoration, regenerative medicine, and acne and aesthetic dermatology. I had lots of questions and you had sent me yours too on Instagram. We'll discuss कि हेयर ऑयल्स, शैम्पूज, सप्लीमेंट्स और ऐसी दूसरी चीज़ों का हेयर ग्रोथ में कितना रोल है और हेयर को फास्ट कैसे ग्रो कर सकते हैं. हम लोग परमानेंट स्ट्रेटनिंग और हेयर कलर्स के इफेक्ट के बारे में भी बात करेंगे. बट बिफोर हियरिंग फ्रॉम डॉक्टर गुलहिमा, प्लीज फॉलो लिटिल फिक्सेस ऑन योर पॉडकास्ट ऐप एंड शेयर इट विद अ फ्रेंड हु माइट बेनिफिट फ्रॉम इट. नाउ टू आवर गेस्ट. हाय डॉक्टर गुलहिमा अरोरा, वेलकम टू लिटिल फिक्सेस.
Good evening, Maitri, and thank you for having me at Little Fixes. It's indeed an honor here. And जैसे आपने कहा that hair fall literally gets to your head, I think you've said it all. And I think without much ado, after your kind words and introduction of me, let's get started.
या सो मेरा पहला क्वेश्चन ही यही है कि मैंने बताया कि जब से मैं बैंगलोर मूव हुई हूँ, आई वॉज इन जयपुर अर्लियर, तो मेरा हेयर फॉल बहुत ज़्यादा बढ़ गया था. अभी 10 months हो गए हैं, काफ़ी आराम है. इट्स नॉट लाइक कि कम्प्लीटली गॉन अवे. बट व्हाट इज दिस लाइक? ऐसा होता है कि लोकेशन चेंज करने से हेयर फॉल होता है, और ऐसा क्यों होता है?
यस मैत्री, आप बिल्कुल ठीक बोल रही हैं. जरूर होता है बिकॉज जब आपकी जगह चेंज होती है, योर हेयर गेट्स इनटू अ शॉक. So obviously a change in environment, change in the kind of water, change in your lifestyle, the stresses induced with a change of place, all of it can lead to increased hair fall. So for example, अगर आप जयपुर से बैंगलोर शिफ्ट हुई हैं, वहाँ का वेदर बहुत अलग है, and your body is used to a certain circadian rhythm, a certain biological clock, which when gets disrupted definitely has an effect on the hair. There are enough studies to show that the hair fall is directly related to stress and a stressful episode such as a change in place. So I'm not surprised when you say that when you shifted from Jaipur to Bangalore, you noticed that आपके बाल ज़्यादा झड़ने start हो गए थे. So yes, it does happen.
और इसके लिए क्या सोल्यूशन है, या फिर ये अपने आप सेटल हो जाता है?
सो मैत्री, इस टाइप का जो हेयर फॉल है, पहले तो हमें ये समझना है दैट दिस इज जस्ट वन ऑफ द कॉजेज एंड यू कांट जस्ट एट्रीब्यूट हेयर फॉल टू वन पर्टिकुलर कॉज. सो डेफिनेटली अगर सिर्फ चेंज ऑफ प्लेस कॉज है, देन यू डोंट हैव टू वरी मच, इट विल सेटल डाउन. बट दैट यू आर गोइंग टू बी नाइव और यू आर गोइंग टू बी फूलिश अगर आपको लगता है कि और कोई कॉज ना हो. सो as we move on with this episode, I think we'll delve more into what can actually cause hair fall. But if it's just a change of place, I don't think there's need to worry so much because that does settle.
ओके, तो फिर अब आप हमें यही बता दीजिए कि हेयर फॉल कैसे होता है. आपने एक चीज़ ये भी बोली कि स्ट्रेस से होता है, मैंने भी पहले हिंट किया था. और ये भी होता है कि जब हेयर फॉल होने लगता है तो हमें और स्ट्रेस होता है.
Yeah, so Maitri, there are बहुत सारी वजह हैं हेयर फॉल की. We've spoken of stress, and आजकल के ज़माने में it is a very important cause. But keeping that aside, I think आजकल if you see our lifestyle is changing a lot. काफी सारे हम लोग of this generation are into a lot of crash dieting or different forms of dieting, and dieting is one of the major causes nowadays for hair fall that I see in my patients. क्योंकि जब आप dieting करते हो या किसी भी टाइप का something which is out of the normal, you are actually diverting all the resources that go to your scalp to grow your hair to other parts of your body which are more important. So the hair is actually a dead part, it is not a living thing. तो क्योंकि वो dead part है, उसमें इतनी न्यूट्रिशन वो नहीं जाता है, वो पहले न्यूट्रिशन डाइवर्ट हो जाता है to the more essential organs. And obviously if we get into too much of dieting and don't have a balanced diet, all of us are so particular about not having carbs or not having too many fats, and let me tell you that in the long run does create a lot of havoc in your hair. The other reason is very closely related to the diet, and that is a lot of deficiencies. आजकल मैंने अपने patients में देखा, especially those with hair problems, that we lack a lot of vitamin D in our bodies. For some reason, India being a tropical country, yet we all have low vitamin D levels, and that is a very important cause for hair fall. So that needs to be set right. Indians are basically kind of deficient in iron all the time, which is one of the major nutrients of the hair. So, deficiency of iron, vitamin D, or even zinc, certain essential minerals are all very important. So, diet ho gaya aapka, aapke deficiencies ho gaye. Another very common condition linked to our lifestyle, which a lot of girls have, not boys, but probably girls, is the polycystic ovarian syndrome or a hormonal imbalance.
Mm-hmm.
And because of our hormones going haywire, again related to our lifestyles, because we don't exercise too much, we're busy sitting in front of our laptops most of the day due to work, that also can lead to hair fall to a certain extent. And these are what some of the major causes. And of course, having some kind of a genetic overlay, if you generally have a problem with hair fall, it's genetic, hereditary, hard water, there could be any major illness. So आपने देखा होगा कोविड के टाइम में almost everybody complained of a post COVID hair fall. It
Hmm.
was so, it had become a pandemic in a pandemic, you know.
Hmm.
And that is something that is to be taken note of, because any major illness or a major surgery, any major event that your body is going through can cause hair fall, because again everything is diverted towards the most more essential organs, and you tend to have increased hair fall. So, and then of course, not to forget, my three, don't forget the parlor styling and the blow drying we all do. We don't have time
Hmm.
to dry our hair, and the heat styling and the treatments are so much in nowadays. In the long run, we're just causing a lot of problem to our hair.
Mm-hmm. Yeah. So you told us a lot of causes, डॉक्टर गुलिमा. इसमें से एक चीज़ आपने बताई कि न्यूट्रिएंट डेफिशिएंसी की वजह से हेयर फॉल होता है. तो क्या अगर हम सप्लीमेंट्स ले लें इन सब चीज़ों के जिन जिन में हमें डेफिशिएंसी है, मान लीजिए हमने अपना ब्लड वर्क करा लिया, वी नो कि इसमें डेफिशिएंसी है, तो डज इट हेल्प? या फिर और जैसे ओटीसी सप्लीमेंट्स बहुत आते हैं कि आयरन का खा लो, फोलिक एसिड का खा लो. बहुत सारे ब्रांड्स हैं जो क्लेम करते हैं कि हमारा ये सप्लीमेंट खा लो, आपका हेयर फॉल सही हो जाएगा. वो कोई टेस्ट या कुछ भी कराने को नहीं बोलते. तो इस तरीके की चीज़ें कितना हेल्प करती हैं?
सो मैत्री, ये तो दिस इज अ वेरी इंपॉर्टेंट क्वेश्चन, एंड ये बहुत ही मायने रखता है आजकल के सिनेरियो में, बिकॉज most of us are moving to e-commerce sites for buying everything now, and that
हुँ,
includes even products related to the skin and hair. And this is something that is a bane as well as a boon, I would say, because uh, you know, you fall for a lot of marketing gimmicks, you don't know the science behind them, you're not visiting a qualified specialist who can actually rule out. मैंने इतनी सारी बातें आपको बताई, अब खाली एक ओटीसी सप्लीमेंट खा के या लगा के तो आपका हेयर फॉल नहीं रुक सकता, अनलेस इट्स ड्यू टू एन एपिसोड विच विल स्टॉप. वो आप ना कोई इन्वेस्टिगेशंस कर रहे हो अपने लिए, आप कुछ नहीं कर रहे हो. So there you have to look at this in a very, with a very, I wouldn't even say a pinch of salt, I would say with a whole lot of salt, because you won't know, it's your luck whether it works for you or not. Well, at this point, there are certain OTC products which are good and which do help with hair fall, but you should remember that you should use something ingredients in those products should be well researched and should have some scientific backing. Otherwise, you're just trying out stuff at the cost of your hair, which is important. So not all OTC products work, some do.
हम्म। ओके। तो इसी से हम एक और क्वेश्चन आता है हेयर ऑयल वाला कि हमारे टाइम में हम लोग छोटे थे तो बोला जाता था, अभी भी बोला जाता है कि चंपी करो बाल अच्छे हो जाएंगे, या फिर बाल टूट रहे हैं तो वो रुक जाएंगे, नए बाल आ जाएंगे। तो ये सब में कितनी सच्चाई है?
So Maitri, ये Indian scenario, Indian culture में, I think oiling is a very plays a very important part since the times of our ancestors.
हम्म।
And जरूर अगर कोई दादी माँ के नुस्खे हैं इस टाइप के, तो they are not without any claims. कुछ तो उसमें claim है. So let me just tell you first of all that coconut oil, जो नारियल का तेल होता है, वो एक ही ऑयल है या एक ही तेल है जो आपके हेयर शाफ्ट या हेयर क्यूटिकल्स, जो हेयर की परत है, उसको पेनिट्रेट कर सकता है. देयर इज नो अदर ऑयल दैट कैन पेनिट्रेट द हेयर शाफ्ट. So if you really want to improve the strength of the hair, it is only and only coconut oil that you must use. Na mustard oil, na olive oil, na koi bhi other sunflower oil,
अनियन
no.
ऑयल।
Pardon?
अनियन ऑयल, ब्लैक सीड ऑयल, बहुत सारे क्लेम्स आ रहे
Yeah.
हैं उनके भी।
Yes, so there's rosemary oil, which does
हाँ।
help, but none of these really help. Onion oil, I'll just come to the onion oil part a bit, but
हम्म।
coconut oil is the only one that penetrates the shaft. All other oils are good provided you do not have acute hair fall. अगर आपके बाल झड़ने वाले फेज में हैं और बहुत ज्यादा झड़ रहे हैं, उस टाइम पे कोई भी ऑयल सिर पे, स्कैल्प पे लगाना is contraindicated because you do not want to create too much of friction to dislodge the hair from its follicle. But
हम्म।
for natural hair care, when it's not falling, and once in a while, if you want to oil your hair, it is not a bad idea to do your chumpy because that improves the vascularity in the scalp. It improves the oxygenation, the blood supply to the scalp, and does to some extent promote hair growth, but not in the acute phase. Secondly, all oils except coconut oils improve the luster of your hair, the shininess of your hair, the anti-frizz part of it. So the hair looks silkier and smooth and more moisturized. सो
हम्म।
ऑयल इज गुड बिकॉज अगर आपके बाल बहुत रफ हो या ब्रेकेड ज्यादा हो, देन ऑयल डज हेल्प ऑन योर ट्रेसेस बिकॉज इट्स नॉट, व्हेन यू comb it out, it's not going to break. So you not just have to protect the roots but also the strands of the hair. Onion oil now. I'm sure all of us have heard about onion shampoos and onion oil and onion juice for hair loss.
हम्म।
One word of caution here, Maitri. कभी भी प्याज का जूस किचन में निकाल के डायरेक्टली स्कैल्प पे मत लगाइएगा बिकॉज दैट कैन बी वेरी इरिटेटिंग टू द स्कैल्प. और अगर आपके हेयर फॉलिकल्स मर गए तो या बिल्कुल खत्म हो गए तो उनमें से कभी बाल नहीं आ सकते. There is a science behind using onion oil, but I think a well formulated preparation is better because they say onion oil में sulfur होता है, and
हम्म।
sulfur is important for hair growth. Okay, it is a
हम्म।
micronutrient that is important. So that's the science. The other part in onion oil is that it's got something in it that reduces the male hormone that causes hair fall. So if it's a
ओह,
hormonal cause, DHT
डीएचटी
कहते हैं,
ब्लॉकर,
yeah,
या।
dihydrotestosterone करके आता है, एक hormone होता है, due to
हम्म।
which there is one kind of patterned alopecia. It's not the hair fall we are talking about. Well,
हम्म।
onion oil does have some kind of role to play, but you can't really say that's really going to work as a monotherapy or anything like that. So this is the thing behind oils. Yes, oiling the tresses is good. Doing it on the scalp in acute hair fall, from me as a dermatologist, I would not recommend it.
ओह, ओके। क्योंकि हमारे यहाँ ये भी बोला जाता है कि अगर बाल झड़ रहे हैं तो और ऑयल लगाओ।
नहीं, वो तो बिल्कुल ही मिथ है बिकॉज ऑयलिंग हैज नो रोल टू प्ले फॉर हेयर फॉल, नो रोल एट ऑल.
ओके। आपने बोला कि जो कोकोनट ऑयल है वो हमारे हेयर शाफ्ट में पेनिट्रेट कर सकता है।
हाँ जी.
वो अगर पेनिट्रेट करता है तो क्या वो हेल्प करता है किसी तरीके से
हाँ
हेयर
जी,
की?
बिल्कुल करता है आपके हेयर शाफ्ट को थोड़ा और मॉइस्चराइज करके थिक करेगा. सो एज आई सेड, व्हेन यू ब्रश इट आउट, it is
हम्म.
not going to fall off or break, at least from the strands. So you have to make sure the roots are strong, but you also have to make sure that the hair shafts are strengthened enough so as not to come out.
ओके. और मेरे पास इंस्टाग्राम पे क्वेश्चन आया था कि कौन सा सेरम बालों के लिए अच्छा है, तो आई डोंट नो कोई
Okay.
स्पेसिफिक प्रोडक्ट की हम बात
Yeah.
करें या नहीं करें, बट आजकल बहुत सारे
So,
हेयर ग्रोथ सेरम्स
Maitri,
भी मार्केट में आ रहे हैं कि उनको स्प्रे कर लो और आपका हेयर ग्रो होने लगेगा. गलती से अपने फेस पे मत कर लेना, नहीं तो फेस पे हेयर आ जाएंगे. ये इस तरीके के बहुत प्रोडक्ट्स हैं, तो इनके बारे में हमें बताइए.
so Maitri, आप जो सीरम की बात कर रहे हैं, which
हम्म.
grows hair on the face, is basically minoxidil, and that is
हाँ.
not really a thing that should be played around with. It is no doubt an OTC
हाँ.
product, but it is a prescription based medicine.
ओके.
Minoxidil is was originally used to lower blood pressure, and it is the best medicine for hair growth. All right, but
हम्म.
minoxidil, agar aap see, hair serums mein bahut sare ingredients hote hain. I'm
हम्म.
talking about this particular ingredient known as minoxidil, which I feel should not be tried out without the prescription of a dermatologist. Now, minoxidil को आप जब शुरू करते हो, initial 4 to 6 weeks में, minoxidil can cause increased hair fall. And if you start using minoxidil, it is very difficult to stop it without your doctor telling you, because the moment you stop it, जो बाल आपके growing phase में वो shift करता है, वो
हम्म.
वापस से shedding phase में आ जाते हैं. And the moment you stop minoxidil, you can have a rebound shedding. So
हम्म.
minoxidil as an ingredient, I would steer clear of without a prescription. But there are other serums which may be tried as OTC serums, and those contain peptides. So peptide serums
हम्म.
are in the way a little safer, not like minoxidil to grow hair, but they are good enough to prevent the or to reduce the hair fall, I would say. And you also have saw palmetto, which has a lot of which has a substantial body of study behind it that does help. So saw palmetto is a good ingredient. Peptides have capexil. They've got lots of other good goodies in them which do help with hair fall. So don't just pick up anything and use it. I think minoxidil, the take home message is, don't use minoxidil on the hair without the prescription of a dermatologist.
ओह, ओके. सो डॉक्टर गुलिमा, किसी ने मुझे क्वेश्चन ये भी भेजा कि मिनॉक्सिडिल वर्सेस रिडेंसाइल, इनमें से कौन सा बेटर है, तो इसके लिए आप क्या बोलोगे फिर?
मैत्री, ये बहुत ही टेक्निकल क्वेश्चन है. एक्चुअली आई शुड नॉट बी टॉकिंग अबाउट इट हियर ऑन
हाँ.
अ पॉडकास्ट, बट
हाँ.
minoxidil is a prescription based medicine which is given for baldness. It
हाँ.
is not really a medicine for acute hair fall.
हम्म.
Redensil would be better to use for acute hair fall. तो दोनों की अपनी अपनी जगहें हैं. Minoxidil is the only US FDA approved medicine or drug which should be used to get back hair. That's the only medicine that can grow hair. There's no other medicine.
ओके. तो जिन्होंने मुझसे इंस्टाग्राम पे पूछा है, उनके लिए
अच्छा.
एडवाइस ये है कि आप डॉक्टर से कंसल्ट कीजिए और उसके बाद आपके डॉक्टर के एडवाइस को फॉलो कीजिए, राइट?
बिल्कुल.
ओके. नाउ वेरी इंटरेस्टिंगली, कोलैजन का भी बहुत सुना है कि कोलैजन खाओ तो उससे नेल, स्किन, हेयर अच्छे हो जाते हैं. जो टॉपिकल कोलैजन था उसके साथ अब खाने के लिए तरह तरह की चीज़ें आने लगी, लिक्विड्स आते हैं, पाउडर्स आते हैं, टैबलेट्स आती हैं. तो इनके कोलैजन के सप्लीमेंट्स के बारे में आपका क्या थॉट है?
Collagen has become a real big fad nowadays, and I think it's a little too overhyped compared to its actual use and scientific evidence to support it. Now, collagen is an excellent supplement for the joints. Okay.
हम्म.
I mean, जिसको भी आर्थराइटिस है या जॉइंट पेन्स है या ऐसा कुछ है, उनमें कोलाजन बहुत ही अच्छा काम करता है. इनफैक्ट डॉक्टर्स प्रिस्क्राइब इट. Coming to the skin, nails, and hair, there are some studies for the skin which say कि अगर आप 12 weeks के लिए उसको लगातार खाते हैं या पीते हैं या किसी भी फॉर्म में लेते हैं, घोल के लेते हैं, as you said, there are so many preparations,
हम्म.
then it does help with improving the plumpness of your skin. It does
हम्म.
give a little anti-aging benefit. For the hair, I have noticed that collagen does help with improving the frizz of the hair. I
हम्म.
do believe. But Maitri, how justified are we as doctors or even as normal people to pick it up as an OTC product? It's not a cheap thing, it is a pretty
Yeah.
expensive product. How justified are we to just use something to do away with only the frizz of our hair with a collagen supplement? I mean, can't you just do it with, an oil or a hair mask, or a proper conditioner or a leave-in conditioner? They would
Yeah.
work equally well. In fact, your diet would help you more. If you take in omega-3 fatty acids, you're taking in other nutrients, I think it would work even better. So I'm not very convinced as a doctor about using collagen for the hair, but let me tell you, I have used it in a few patients and noticed that the frizz improves beautifully. Okay, so for people
Mm-hmm.
who insist or are taking it for something else, in them, if you're giving it as a compounded thing for various problems, then it
Mm-hmm.
is justified in using it.
ओके, मतलब अकेले कोलेजन लेने का कोई मतलब नहीं है। और कोलेजन का क्या ऐसा भी है मैम कि एक फॉर्म दूसरे फॉर्म से बेटर है, जैसे लिक्विड्स आर बेटर देन पाउडर या फिर टैबलेट्स आर बेटर देन लिक्विड्स, ऐसा भी कुछ है क्या?
हाँ जी, सो देखिए, दैट डिपेंड्स ऑन हाउ मच इज ऑब्जॉर्ब। इफ यू आर टेकिंग एन ओरल कोलेजन, यू हैव टू
हुँ,
अंडरस्टैंड, आप जो लेते हो अंदर, वो डायरेक्ट बाल में या स्किन में नहीं जा रहा है।
या
Okay, so it's not the same as just taking it and making sure it's going to go home to the area where it's needed. It doesn't happen like
या
that. So I mean, it has to get absorbed from your intestine, from your stomach. It has to go through your blood, then it have from the bloodstream, it has to grow to that or go to that organ. So it's a whole big process. So there are different forms, hydrolyzed and non-hydrolyzed collagen supplements. So hydrolyzed are better, and obviously the time of taking it, whether you take it on an empty stomach, with or without food, there are a lot of things that help. There are sublingual ways, there are powders. Yes, obviously, if you take it in a powder formulation, they are smaller pellets, so obviously the absorption is definitely better. Liquids are better absorbed. So these are formulations, they are things that, you know not too much, but they do help a little bit. They score a little bit over the other, but I wouldn't say they would make a world of a difference if you don't take a capsule and take a powder form. So it depends. At the end of the day, it depends on what is convenient for a particular person who's taking it in. What is the best form they like? I wouldn't like to drink a shot. I would like it in the capsule form. Some don't like the aftertaste. So it
हुँ,
really depends.
ओके। अच्छा डॉक्टर, अब मेरे माइंड में एक क्वेश्चन और आ गया है आपकी बातों को सुनकर कि मरीन कोलेजन या एनिमल सोर्स कोलेजन?
So, Maitri, if you are talking of collagen, I
हुँ,
think there is no source better than the marine form that is going to help you. Because
ओह!
non animal based collagen is, I think you're talking of a different kingdom, from a plant kingdom to the animal kingdom. A crossover is really not, I mean, it's too far for me to think that it's going to work. Even coming from an animal source like the bovine hoofs or something like
हुँ,
that would somehow help, because at least it's the animal kingdom. But I think the marine collagen has the highest amount of collagen in it, and definitely I've tried it out, it works the best. One point here, for those who are non-vegetarians, I think taking chicken broth would work even better than popping in a pill of marine collagen.
हाँ, ओके। एंड मैंने कहीं ये भी सुना था कि स्पाइरुलिना होता है, वो नेचुरली कोलेजन के प्रोडक्शन में हेल्प करता है हमारी बॉडी में। तो क्या स्पाइरुलिना लेना कोलेजन लेने से बेटर है?
So spirulina is a subset. Yes,
हुँ,
there is no harm in taking it. But as we're talking about hair today, it is an ingredient you can incorporate as a cocktail in your hair supplement if you are taking something. Yes, I think it does work a little better than collagen, in my
हुँ,
experience.
हुँ। ओके, वेरी इंटरेस्टिंग। थैंक्स फॉर द शेयरिंग दैट डॉक्टर गुलेमा। अ, और अगर हम थोड़े-से कॉस्मेटिक साइड पे चले जाएँ, तो हमने हेयर ऑयल और इन सब की बात करी, और साथ में ये शैम्पूज़, कंडीशनर्स, ये भी बहुत सारे क्लेम करते हैं कि आपके बाल अच्छे हो जाएँगे, बट आई थिंक मोस्ट ऑफ अस अंडरस्टैंड कि इनसे कुछ ऐसा बेनिफिट नहीं होने वाला है कि आपके बाल ग्रो हो जाएँगे। आपका क्या थॉट?
So, Maitri, आपने जो कहा, I think that's you're on the bullseye. Absolutely, no shampoo or conditioner can reduce hair fall or cause hair fall. दोनों.
अच्छा,
मेरे
ओके।
पास बहुत पेशेंट्स आते हैं जो बोलते हैं जब से शैम्पू यूज किया मेरा हेयर फॉल
हुँ,
बढ़ गया है, या
हाँ, हाँ।
you know that can't happen. It cannot. There
ओह!
would be something else in play, but your hair doesn't generally fall because of a shampoo. Now, using a medicated shampoo, if you're using it, it can cause a little roughness in your hair due to which there may be breakage. That's the only way I can think a shampoo can increase hair fall, but otherwise, it's foolish to think a shampoo se hair fall hoga. Coming to the contrary,
हुँ,
it's such a marketing gimmick to say this is an anti hair fall shampoo and so on and so forth. So
हुँ,
I again feel if it's a sulfate free shampoo, if the cleansers in the shampoo are, not very harsh, so you don't
हुँ,
have surfactants that are very harsh to cleanse your scalp, then gentle shampoos will help because they're not going to worsen the hair shaft. So you remember, we are
हुँ,
talking of not just strengthening roots, but hair shafts. So using sulfate free shampoos will help grooming your hair better and helps prevent breakage. That's the only thing I can think of. Some shampoos do have incorporated ingredients which are anti hair fall. Maybe to some extent they may help, but there are no regulations for these things, absolutely no regulations where you can prove how much percentage of those ingredients are there. And it's stretching it too far in a nutshell, so it really
हुँ,
won't help too much. And
ओके,
I
हाँ,
think at the end of the day, it's about grooming the hair, which
हुँ,
is going to help with the hair fall rather than treating. And you must treat the cause rather than worrying about what shampoo to use.
हुँ, हुँ, येस, ओके। सो डॉक्टर, अब हमने बहुत सारी बातें कर ली कि हेयर फॉल के बारे में। अगर हेयर ग्रोथ के बारे में बात करें तो समवन सेंट मी अ मैसेज हाउ टू ग्रो हेयर फास्टर। तो मतलब अगर हमारे बाल नॉर्मल है, सब कुछ हेयर फॉल नहीं हो रहा है, सब ठीक है, तो
समझती
इज़
हूँ.
देयर अ वे कि ज़्यादा जल्दी से बाल ग्रो होने लगे?
या सो मैत्री, ये बड़ा मुश्किल सवाल है,
हुँ,
बिकॉज दिस इज रिलेटेड टू हेरिडिटरी फैक्टर्स.
हुँ,
ओके. एंड मेरे बाल अगर आप देखो, देर इज नो प्रॉब्लम इन माई स्कैल्प. आई डोंट हैव हेयर फॉल. आई एम हैप्पी विद द टेक्सचर ऑफ माई हेयर. आई डोंट स्टाइल माई हेयर. आई डोंट यूज हीट ऑन माई हेयर. Once in a while I color my hair. So I do my hair care very well, but my hair doesn't grow. Now
हुँ,
that is your genetics. You can't really help that. Now, if you want to fight your genetics and grow hair, then the only way you can do it are with medical procedures. Okay.
हाँ,
The best thing you can do is to take out growth factors from your blood and inject them in the scalp, or to use a regenerative modality and then use it. Now, in today's era where we've got such good hair pieces, we've got such good accessories for your social events or a wedding or a close family friend or a relative's wedding, how many of us, I mean, is it justified to spend so much of money on a medical procedure to just grow hair? Is the question. But
हुँ,
since we are at it and you're asking kaise grow kar sakte hai, then it's definitely a medical procedure like platelet rich plasma, or probably a stem cell treatment which has regenerative medicine, which will change the milieu or the microenvironment of the hair follicle and promote more growth. The second
हुँ,
thing is, make sure that you are eating a well balanced diet and sleeping well. Don't mess with your biological clock. That's very important, whether it's sleep, whether it's exercise, whether it's diet. I'm really telling you, if your basics are incorrect, nothing is going to help you with your hair growth. It may not be falling, but the hair just goes into a sleep mode, just like your mobile, if you're overdoing it. And with that, let me tell you, even excess use of your screens or mobiles or your electronic devices have also proved to just make the hair static and or increase hair fall. So one needs to be quite
ओह!
sensible in their approach to all of this.
Okay. Now that is a tough one. Screen time. I think it
Yes.
has become so common. Like हर कोई अपनी स्क्रीन पे हमेशा रहता है, and you were
बिल्कुल.
saying कि it affects our hair health. सो अब हेयर फॉल से आते हैं स्प्लिट एंड्स पे, तो क्या हम इनको प्रिवेंट कर सकते हैं?
हाँ जी। तो ये वेरी गुड क्वेश्चन है, आपने इसी में आंसर भी दे दिया है मैत्री, बिकॉज यू सेड कैन यू प्रिवेंट इट. द बेस्ट ट्रीटमेंट फॉर स्प्लिट एंड्स इज प्रिवेंशन ऑफ स्प्लिट एंड्स. Okay.
हम्म।
And you, once they happen, you have no other option but to get your hair cut. You can't
या।
treat split ends. Agar split ends aa gaye, your hair is not going to grow. That's another cause why your hair may not be growing. If you have split ends at the end, it's best to get a trim, because the hair starts growing, in the two parts. It doesn't grow long enough, and wo branch out ho jata hai. The branches keep growing and the length decreases. Now, prevention of split ends, you need to again come back to all your basics. But more important than your basics and lifestyle changes are to keep your hair well groomed, in the sense well moisturized. If your hair is not well moisturized and your texture is not good enough, which can change due to the water, the hard water, or the change in season, or the change in aging. Also, aging of the hair can also cause reduced hair growth. It can cause excessive roughness of the hair. It can cause graying of hair. So all these things are factors. You need to know what exactly is causing the split end. And of course, remember, if you're overusing shampoos, using very harsh shampoos every day, not on your scalp but on your tresses, you are going to damage your hair. You're using too much of chemical on your hair, you're damaging of your hair. Using too much of hair color, you're damaging your hair. So you need to protect the hair shaft and keep it well groomed and have a good texture. That's the first thing to avoid split ends. And then, of course, you need to understand all the basics I've told you come in play everywhere.
हम्म। ओके। दो तीन लोगों ने मुझसे पूछा कि ये हेयर स्ट्रेटनिंग, स्मूथनिंग, हेयर बोटॉक्स, इसका क्या इफेक्ट होता है हेयर पे, और वेवी हेयर के
Okay.
लिए इनमें से कोई ट्रीटमेंट अगर करवाना चाहें तो कौन सा ट्रीटमेंट बेटर है?
Okay. So, as a doctor,
हम्म।
kuch mat karao, because
हम्म।
they're all bad. If you
ओके।
are suffering from hair fall, or if you are prone to excessive hair damage and fall, please do not get any of them done. But if you have healthy hair and you want to do something, then hair botox is the best treatment out of all the others. The others, like a keratin or a cysteine or a Japanese groom or a perm, okay, better than all of these is getting a hair botox done, because it has the least amount. They claim koi chemicals nahi hote, which is not true, but it is the safest of the lot. The worst among these is a keratin treatment. And that's
ओह।
because keratin definitely uses a chemical known as formaldehyde. And we are really scared of formaldehyde for lots of reasons. The first being, especially causing you're inhaling the fumes all the time, because these treatments take long. You go to a salon, you have to wait out for many hours before the treatment ends, and you're inhaling those fumes constantly, and they can cause a problem in your respiratory tract. They can cause irritation in the eyes. And what we're really scared of, there are studies to prove that it can be a carcinogenic. So why do
ओके।
you want to expose yourself to something which is a trigger? I mean, nowadays we are exposed to so many synthetic and artificial things, and a cumulative dose of all of that is what can trigger a cancer, which probably was not very well heard of in the earlier days. Maybe people didn't live that long, whatever, but we are seeing it on the rise now. And I think we should eliminate anything that we are skeptical about, especially something that can
ट्रू।
be avoided. So, keratin is something, especially if you're having hair fall, don't do it. Because with after keratin and cysteine, even if you're not having hair fall, 3 or 4 months later, I've got lots and lots of patients who come in and say, Mera hair fall start ho gaya, and I ask them, Aapne kya koi treatment karaya tha? And they tell me keratin karaya tha. So keratin is something I am just not going to allow. A Japanese treatment or a straightening treatment is somewhat like a keratin. And a perm again uses, there is a rebonding of the protein and the structure of the hair that occurs with all of these. And it's like you are messing with the natural biology of your hair. So, I mean, as a doctor, if you really need to do it, I think hair botox would be the best. But again, you have to take it with a lot of salt in it, not just a pinch. Stay clear of all of these because of the chemicals involved, and doing away with the natural biology. It's so much more difficult to color, style, or even dry your hair after these treatments. You're
Mm-hmm.
playing around with the natural thing. I mean, I know it's a fad, it's a fashion. I can't say mat
Mm-hmm.
karao bilkul bhi. I can't be that, you know, meanie doctor. But weigh the risks and benefits. Be aware.
Mm-hmm. Okay. And what do you think about hair colors, highlights, Dr. Gulima?
So again, I mean, सभी कराते हैं, मैंने भी कराया हुआ है, but limit your hair coloring. If you're doing it to cover grays, limit it to the time the grays are really visible. Okay.
Mm-hmm.
If you're doing a hair coloring, highlighting would be better than going in for a global, because you're exposed to much more damage in the hair color if you're getting a global hair coloring done. The
Mm-hmm.
second thing is, if you're pregnant or you're lactating, if it's a girl, avoid all kinds of salon treatments, including your keratin, Botox, all of that, and hair color, because you don't want to expose yourself to any kind of fumes of the chemicals. Hair coloring, don't use commercial colors. It's best to use natural colors, which are PPD free. PPD, or paraphenylene diamine, is one of the most notorious sensitizers that can occur in nature. And all our hair, I mean, a lot of our hair colors do have PPD. Now you do have PPD free colors, ammonia free, you've got resorcinol free. So look at colors which are just sulfate induced and do not contain lyes and PPDs, because these can cause a lot of allergies. And many people always do a test patch before you're doing any hair color. Even if you've used that hair color in the past, it's best to do a test patch, because it takes time to get sensitized to that and then have a reaction. So always do a test patch, and limit your hair color to, as infrequently as you can. You don't have to do it every month. Don't be very regular with it. So these are the few tips I can give about hair color. You do have medicated hair colors, and a natural henna is definitely the best. But what you get as a commercial henna, we don't know what the ingredients are. वो बोलते हैं हर्बल डाइज है, बट उसमें
Hmm.
इंडिगो होगा, ये होगा, वो होगा. So what I'm saying is, natural is to pluck the leaves, crush them, and put them, but then it gives a horrible orange hue. Some people don't like it.
Yeah.
So, but that's the most natural. Anyway, you can react to that as well. Okay, it's not
Uh,
that you can't react to anything. So these are a few tips on hair color that I can give you. And definitely,
okay.
hair color can cause a lot of hair fall and can
Hmm.
also dry your hair. Remember that.
Yeah.
Yeah.
Yes. Yes. Okay. Now I have a few rapid fire type of questions for
Only
you. So, Dr. Gulima, how often should we cut our hair? Is there a guideline?
no guideline. If you want to chop your hair one fine day to look smart with a short, chic hair style, go in for it. But if you've got split ends and your hair is not growing, I think it's time to go in for a haircut. Generally, people say you should go in for a trim in about 6 to 8 weeks. That prevents split ends and this, but I think it's up to the individual. There's no such
Hmm.
guide.
Okay. And next is how often should we wash our hair?
Again, it depends. Some people say rose nahi dhona chahiye. Well, others need to wash it every day. So it depends on your physical activity. If you're gymming a lot, you're exercising a lot, the weather is bad, you have a work which is in the field, you may need to wash your hair every day. But then be careful, you're using a sulfate-free shampoo which is gentle, not using too many clarifying agents in your shampoos, because you don't want damage your hair. For normal people, washing it about twice a week may be okay. For others with dry scalp, you may want to just wash it maybe once a week or just twice. Too oily, you may need to be more frequent, but then don't overdo the washing, because people with oily scalp whose hair gets very oily every alternate day may be overzealous with their shampooing, but then you may be tricking your oil glands to think that ab scalp bahut dry ho raha hai, let's produce more oil. So you may be
Hmm.
working On the contrary, you may be causing more oil. So it really depends. There is no hard and fast rule. And if you've got a condition, if you've got something like dandruff or seborrheic dermatitis, then as doctors we do recommend to wash it every alternate day, or maybe twice a week or thrice a week, depending on the condition. So I think it's again, there's no hard and fast rule. It depends on
Mm-hmm.
a lot of conditions.
Okay. And the third one is, should we sleep with open or tied hair?
Well, that it has a definite answer, Maitri.
Hmm.
Definitely with your hair tied. Okay, because you do not, open hair can cause a lot of issues. One is it can directly affect the face, and
Hmm.
whatever hair cosmetics, dirt, whatever pollution, whatever your hair has gone through can come directly on your face and maybe clog your pores or cause a rash or cause breakouts or whatever it is, or irritation. For your hair itself, it's good to loosely braid it and sleep. Some say even use satin or silk scrunchies on your hair, because
Hmm.
that does help with maintaining the overall texture and grooming of your hair. And you don't want your hair flying everywhere. You don't want to touch it too much. That does help with preventing excessive oil production or whatever. Also, if you keep touching your hair, your hair gets more oily. So I think it is more advisable to tie your hair loosely when you're sleeping.
Mm-hmm. Okay. And now the fourth question for you is, do tight hairdos really cause hair loss?
Oh, yes, they do. There is alopecia or baldness known as traction alopecia. So
Hmm.
people who tie their hair very tight, or get braids done. So we have the people of the African ethnicities and descent who braid their hair very very tightly. They do tend to start getting bald from their front part. And
Hmm.
people who have very tight hairdos often develop a kind of baldness that's occurring right in the front in their temples. And it is advisable definitely to use looser hair tying styles over a tight lead done hairdo.
ओके ओके एंड डॉक्टर गुलेमा शुड वी कीप चेंजिंग हेयर केयर प्रोडक्ट्स क्योंकि कई लोग ऐसा बोलते हैं कि एक टाइम के बाद अगर आप एक ही प्रोडक्ट यूज़ करते रहो तो वो इनफेक्टिव हो जाता है और इज इट ओके टू कीप यूजिंग द सेम स्टफ
Uh, there's only possible one or two scenarios where you may need to change your products. So ye kehte hai kuch log, should keep changing your shampoo. I don't understand why. I think the only two or three situations which are coming to my mind where it would actually make sense is, one is the change in season. Okay. Now, what you use in summer, especially in areas where you have drastic change in seasons, like the north of our country, in Bangalore, of course, you may need not to do it, because Maitri, it's quite a temperate climate throughout the year there. But if you were in Jaipur, I would have told you कि आप जो summer में कर रहे हो, you have to change your routine in the winter. That definitely makes sense, because the winters are harsher, they are devoid of moisture, and the hair gets drier. So you may need to wash your hair less frequently in the winter. You may need to condition it more. You may need to change your hair care a little more in the winter. The second scenario where I feel you may need to change your hair products is with age. Now, I may be using something which I'm very fond of since maybe, 20, 30 years, but now I'm 30 years older, and I may notice certain changes in my hair. I may feel that I need to use products with more SPF because my hair is aging. So, all of these things, again, age is a factor where I may need to change. The other scenario is, supposing I've gone through an illness or a surgery or something like that, then, or I'm having acute hair fall, then I may need to switch over to products which are gentler. I may not use my regular, lovely, fragrant shampoo that I'm using, which I would just suit me at other times. I may need to switch over to a sulfate-free one or something gentler, which is, working better for me during a particular period. And supposing, or pregnancy or lactation, where there is naturally hair does fall naturally, it's a normal scenario, there also I may need to tweak my product usage. So here, these are a few conditions where you may need to change, but otherwise there is no such reason why you should be changing your stuff. Actually, we get so carried away by marketing gimmicks. You look at ads, you look at advertisements popping up on Instagram, Facebook, or on television, and you get tempted to use something. But not everything works for everybody, and what is best for me may be the worst for you. So I think with all of these things, you should focus more on the ingredient, and be a little, think about what you're doing rather than just falling for a particular product.
हम्म. ओके. एंड डॉक्टर, डू यू फील कि जो हेयर कलर वाले शैम्पूज होते हैं कि कलर्ड हेयर के लिए आते
हाँ,
हैं, कलर्ड हेयर के लिए हमेशा वही शैम्पू यूज़ करना चाहिए या फिर हम कोई भी माइल्ड शैम्पू यूज़ कर सकते हैं?
आई थिंक कोई भी माइल्ड शैम्पू यूज कर सकते हैं, बिकॉज दैट्स व्हाट आई डू. Okay, and it works for me. So there are, now again, I think this, we have to look into this a little deeper. So color fast shampoos do, maybe having ingredients, they definitely do, which make your hair color stay longer, but using a sulfate or a gentle shampoo would work as well. I mean, dermatologically, if you ask me, that would be even better. I'm dealing with ingredients I know, known devils rather than unknown devils, and it does help. So unless you're very, very particular, that you have to use a Tresemme or a Kerestem or whatever, which is color fast, or uh, the price goes up so much. I think
Hmm.
you got to, again, here there is no hard and fast rule, but I feel, since you've directly, thrown this question at me, I feel a mild shampoo would work as well.
So now
Good.
my mind is blown after speaking to you. I have learned so much. I'm sure कि मैं थोड़े पैसे बचा लूँगी अपने हेयर केयर पे. So doctor, if you can give one piece of advice to every woman who wants to make her hair better, which is I think all of us, तो वो क्या होगी?
So, Maitri, this is a very good concluding question you've asked me. As a dermatologist, I would like to say, keep a healthy lifestyle and keep your hair well groomed and healthy. So, the pillars of a good hair care routine would be using a shampoo according to your hair type and your scalp type, whether it's oily or dry or normal or sensitive, or whether it's colored or whatever it is. Use a conditioner if you need to. There are some hair types like very straight or fine hair which may not need a conditioner. You don't have to, but most of the times you do need one. So have a good shampoo which is suited to your hair type, which you have tried and tested. Have a good conditioner. Once in a while, you can use a hair mask if your hair is normal or dry or colored, or you're of a certain mature age where you may need it. And make sure that you don't keep popping in supplements unnecessarily. Biotin, for example. I mean, it's so overrated and hyped. Just eating biotin is not going to help with anything. Yes, it may give you a healthy hair if you have to just take it for no rhyme or reason. It doesn't make sense because our diet is seldom deficient in biotin, whether you're a vegetarian or a non vegetarian. So if you're not deficient in it, it makes no sense to take biotin. Okay. The second thing is, don't keep popping in other supplements unless you're proven to be deficient in them. This is another thing which all of us keep doing. And remember, keep your basic lifestyle right. You specifically spoke of women. We have to understand our bodies go through a lot of stress in terms of our being a mother or lactating, or even with our normal household chores or whatever. You need to know that you have to take care of your body, sleep well, eat well, and exercise. So take time out for yourself, and remember, uh, the hair is your crowning glory, and it does cause a lot of stress not to be happy with your hair. So you may not have a good hair day every day, but I think with your basics right, most of your days should be good hair days.
I'm into that. So now, doctor, please tell us a little more about the work you do and how can people connect with you?
How sweet. So, Maitri, I'm a senior consultant dermatologist since about 20 years in this field. And I do a lot of hair restoration. I'm based out of Delhi, as you said. And we not just treat patients with hair problems medically, which is my major focus, because I feel a lot can be treated by getting all of this right, your basics right, But we also do hair restoration. So we do a lot of treatments for balding or for patterned hair loss or perimenopausal hair loss or androgenetic alopecia or other kinds of baldness. So we also do stem cell treatments at our clinic. We are also doing growth factors at our clinic. We're doing PRPs and a lot of other things. We do refer for hair transplant as well. uh, I mean, it's all related to the skin and hair and a lot of anti aging treatments as well. And that's it. If anybody wants to reach out for any advice, which is general, I can give it, not, over social media. Otherwise, it's difficult. They have to take a consultation. That's
Mm.
it.
Yeah. And what's your Instagram handle, Dr. Gulhima?
My Instagram handle is drgulhima.skin. Drgulhima.skin.
Okay, great. Thank you so much, doctor, for sharing so much insights with us. Like, there's so much value in this episode. You do all of these treatments, still you do not recommend them unless there is a real requirement. So, thank you so much for your honesty also and for your amazing, amazing answers. Thank you so much for being on Little
Thank you,
Fixes.
Maitri. It was so wonderful being a part of your podcast, and I wish you all the success because you're really doing good work by reaching out to the masses, and it's our duty to spread the correct and honest advice.
अगर आपको ये एपिसोड वैल्यूबल लगा तो प्लीज हेल्प लिटिल फिक्सेस रीच मोर पीपल बाय शेयरिंग इट विद समवन यू केयर अबाउट. यू कैन ऑल्सो गिव अस अ शाउट आउट ऑन इंस्टाग्राम. मेरा हैंडल है @littlepixelspodcast. दिस हेल्प्स मी इन ग्रोइंग द पॉडकास्ट और बहुत सारे और लोगों की हेल्प भी होती है इसको सुन के. आई एम ग्रेटफुल फॉर योर टाइम. अब मिलते हैं नेक्स्ट वेडनेसडे को. तब तक के लिए खुद से प्यार करते रहो और सदा सैसी रहो. बाय.